Medial tibial stress syndrome, better known as shin splints, common injury, also commonly misunderstood. So shin splints don't actually indicate a certain pathology. It doesn't tell you actually what's going on. All it means is you have a vague, diffuse pain at that lower medial portion of the tibia, that classical sign where you touch that inside portion of that leg. That's all it indicates. That's what shin splints are, but it doesn't say what's actually going on. So during exercise, during running, when the foot hits the ground, there's a certain level of bowing or deformation that that occurs in the tibia with each stride. This bowing or bending of the tibia with each stride is going to create a microtrauma, which is fine. If somebody goes about their running program appropriately, the body will adapt, and that bowing and bending will be used as a stimuli to adapt and become stronger. Of course, if the body is overwhelmed, if that tibia is overwhelmed, that bowing, that bending, that deformation to the tibia is going to overwhelm the bone and potentially lead to shin splints. Tendons connect bone to muscle, so it's also believed that there's some level of tendon pulling at that bone as those tendons control your foot with each stride that you take. And that pulling at that bone, that tensile force, can potentially, of course, overwhelm that bone, leading to shin splints. Of course, that tugging from that tendon at the bone can also serve to help the bone to adapt, but again, it just depends. Does your body have time to adapt in between your sessions? So shin splints don't indicate a certain pathology. It's literally just about a 5 centimeter pain at that lower limb. That's probably what's going on. It's probably going to be a tendon that's irritated, which also pulls at that tibial bone. Flexor digitorum longus, anterior tibialis, posterior tibialis, soleus, and that tibial bone is going to take a lot of stress as you run. It's going to deform to a certain extent, which is fine. It's a microtrauma, but again, if it's overwhelmed, that healthy stress of that bending and bowing of that tibia can either help you to adapt or it can hurt you and lead to something like shin splints.